question that I often get asked is, does LASIK wear off? And the answer is no, LASIK doesn't wear off, although people have that feeling sometimes because their prescription changes. So the actual laser that does the resculpting of the cornea, that effect doesn't wear off. But sometimes in the healing process, there's something called epithelial hypertrophy, and that's when the skin of the eye overgrows a little bit and causes some regression of prescription. So this is something where it gives the patient the appearance that some of the effect of the surgery has worn off. It doesn't happen in many patients, but when it does happen, we could always do what's called an enhancement surgery or a touch-up, which is safe to do and something that happens in about 5 to 10% of cases, depending on the original prescription of the patient and the age of the patient. There's also something called progression. Just like when a person would wear glasses and contact lenses, and then every few years they'd go for an eye checkup and their prescription would change. That can still happen in an eye after LASIK, although it doesn't often happen because we make sure the person has had a stable prescription for a long time before they have LASIK in the first place. Remember, the eye is still a living, dynamic organ, so even after LASIK, in some cases, the eye can change in such a way that may require a second procedure known as a touch-up or an enhancement.